Topic 3: Attention Deficit Hyperactivity Disorders, also known as ADHD. What is ADHD? Okay, ADHD is a heterogeneous behavioral disorder of uncertain cause that always is evident in childhood but that typically persists through adolescence and for some into adulthood. Children with ADHD would exhibit these three kind of behavior. The first one is inattention, second one is hyperactivity, and the third one is impulsivity. Exhibit 1: inattention. What are the type of characteristic that they will show is that failure to attend to details, difficulty sustaining attention during play, and inability to listen actively to instruction or conversation. Next is difficulty organizing tasks and avoidance of tasks that require sustained attention. This child is easily distracted and is often forgetful in daily activities. Exhibit 2: hyperactivity. The characteristic for this exhibit would be they are frequent fidgeting and then the inability to sit when remaining seated is expected. The third one would be difficulty to play quietly, excessive talking, and being constantly on the go. And the last exhibit, exhibit 3, impulsivity. The characteristic that would be shown by children with ADHD would be the inability to wait one's turn, frequent and incessant interruption, blurting out of answers before a question is asked, low frustration tolerance, sleep disorders, bossiness, excessive and frequent demands for attention, mood lability, demoralization, dysphoria, peer rejection, and poor self esteem. And there are high risk for injuries associated with increased risk taking behavior and impulsivity. There are two primary medical intervention strategies. The first one is stimulant pharmacotherapy, and the second one is behavioral intervention. Okay, as for the first one, pharmacologic treatment seems to improve overactivity, attention span, impulsivity, and self control, compliance, physical and oral aggression, social interaction with peers, and academic productivity and accuracy. Rarely, however, are medications alone sufficient to allow a children to function in most settings. Deficits that seem to persist are those in reading skills, social skill, learning, academic achievement, and antisocial behavior. And as for the second intervention would be behavioral intervention. The most frequently recommended therapies include CBT, cognitive behavioral therapy, behavior modification, educational intervention, social skill training, and psychotherapy. Although the definitive efficacy of any one strategy has not yet been determined, it is clear that a consistency in response in all of the child setting, the environmental adaptation, and counseling to alleviate low self-esteem contribute to improve in learning and attainment of social skills. Let's continue to the next topic: learning disabilities, also known as LD. Okay, what does it mean by learning disability? Learning disability, also known as LD, is a generic term that refers to a heterogeneous group of disorders manifested by significant difficulties in the acquisition and use of listening, speaking, reading, writing, reasoning, or mathematic abilities. Okay, there are nine categories of LD behaviors. The first one is disorders of mood function. Second, educational disorders. Third, disorders of attention and concentration. Followed by fourth, disorders of thinking and memory. Five, problem and speech communication. Six, auditory difficulties. Seven, sensory integrative and perceptual disorders. Eight, social problems. And last but not least, specific learning difficulties that accompany the learning disability. Category 1, disorders of motor function. These include disorder both of motor skill and of motor activity level. Motor skill dysfunction may range from clumsiness to poor performance in gross or fine motor skill, GMS and FMS, to problems planning new tasks, also known as dysphagia, to equilibrium deficit, to sensory motor problems in a number of areas. Sometimes tics, grimaces, and choreoattitoid movement in the hand may be observed. The child may be described as always being in motion, hyperactive, or as being slow and lethargic, hypoactive. Category 2, educational disorders. Educational disorders can occur in one or more academic subjects. Related educational skills that are often limited or delayed are copying from the blackboard, printing and cursive writing, organizing time and materials, understanding written and oral direction, symbolic confusion, for example, reversing letters, cutting, coloring, drawing, and keeping place on the page. Category 3, disorders of attention and concentration. Examples of these disorders include short attention span and other attention deficit, restlessness, impulsivity, motor and verbal perseveration. Category 4, disorders of thinking and memory. These types of disorders are characterized by difficulty with abstract reasoning and concept formation, by poor short and long term memory capabilities. Category 5, problem with speech and communication. In these cases, the child may show difficulty shifting topics of conversation, difficulty with small talk, difficulty with the sequencing of words, sentences, or sound, slurred words, and articulation problems. Category 6, auditory difficulties. Okay, auditory difficulties associated with LD often stem from auditory perceptual and auditory memory problem and not for acuity hearing problem. Children with these activities of children with these type of problems are often the ones who cannot remember the oral direction just given to them. Auditory memory cannot sound out words or blend sounds into words. Phonemic synthesis cannot block out background noise, speech in noise, and cannot remember the sequencing of sounds, words, or numbers. Auditory sequencing. Category 7, sensory integrative and perceptual disorders. Children with LD often have various sensory integrative and perceptual disorders. Many of these children have difficulty with laterality and directionality concept and tasks that require visual perception skills. Category 8, social problems. This disorder may be manifested as temper tantrum or antisocial behavior, and the child's social competency may be delayed compared with his or her chronologic age and mental age. Many of these children are sensitive and decidedly at risk for poor self esteem and poor self concept problems because they have the intelligence to know when they are being teased and to know the frustration of being good at some things and not at others. Okay, category 9, last one. Specific learning difficulties that accompany the learning disability. This is the most frequently a specific reading disability. That's all from me. Thank you.